So our guest today, and all of my documents have gone kafooey. I'm going to have her introduce herself, but she's been on the show before. An amazing dentist. She's got books that she has written on this subject, and children's books to help our children to be more successful in the chair. So let's welcome our guest. And because my computer has gone completely kaflooey, I need you to completely identify yourself and tell us what your credentials are. Thank you so much.
Hey, Shannon, it's good to see you again.
Good to see you too.
I am a dentist. I've been working with children for the last 20 years, and I have written multiple books for children to help them, get over the fear of dentistry, educate them about the importance of good oral health and making their dental visits easy. So it's been a long ride, but, a fun ride, I would say.
And tell them what your name is, because I don't even have that in front of me because my computer has gone completely crazy.
Well, my name is Dr. Humairah Shah. If you've heard about the drug Humairah on the TV, that will make it much easier. But everybody knows Dr. Shah.
Okay, so wonderful. So let's talk a little bit about what parents need to know right now for everybody who's sitting there at home and they're like, oh, I've got this child or these children on the autism spectrum, and I don't know. Some people, I hate to say this, Dr. Shah, some people have said, this is just a fight I'm not willing to have because I can't even get my child to brush their teeth. So talk to us a little bit about your point of view as a dentist and what you want us to know for individuals on the spectrum.
So, it's not easy, getting a child to dentist, if your child is on autism spectrum, getting their teeth brushed. It's a little bit of a struggle. I agree with that, but there are ways to make it easy. So first thing first is start early. So nothing is new to them as they are growing up, which would mean like start brushing their teeth when they are babies, as soon as the teeth erupt. Then once it's a routine and they're used to it as they are growing up, it's not a new experience. Routine is the most important thing for all kids with special needs. So as soon as you see the tooth come in, start brushing their teeth. That way they're already used to it. They know this is going to happen.
So that's great advice for those of you who have the really small children. It's like, when is a good time to start now? Absolutely. But for anybody who started, who didn't, we didn't have the benefit of you telling them that 4 or 5 years ago. What do you have any tips and tricks for us to be able to make this palatable or even fun now?
Yes, I do. So what I would, a lot of kids with autism have sensory issues too. So that makes it even harder. You put the toothbrush in their mouth. It's not like any other child. It's a little harder. So what I would suggest is go see some videos, make it fun for them. There are so many songs. This is how we brush our teeth. They can dance. Autistic kids enjoy visual, music, dance. So while you are helping them brush, get them busy with the video. Another thing is reading. Reading will help them, make them understand why is it important to brush their teeth. I had written Sam and the Sugar Bug, and I actually added narration to it just for the kids with autism. And it was widely accepted by the kids because they could hear it and see it. That version is specifically for the kids with autism. It's available on iBooks. I'll send you the link so you can share. The book is also in hardcover. It's called No Rushing When Brushing. So what it has is it has 2 books in it. One is tells them a story why it's important to brush, and another one, what's going to happen at a dentist. So when they go there, it's not that difficult.
Yeah, well, let's talk a little bit about when we start to go to the dentist, because at what age do you recommend that we start taking our kiddos to the dentist?
First birthday is when
Wow.
Yes, that is the key here for every child, not only kids that are on spectrum, but every child should visit a dentist after their first birthday. Now, let me explain to you why. There are multiple reasons. First of all, you will get educated by the dentist, what you need to do, what you don't need to do. Second, your child is young. So as he grows up, you're going every 6 months. This becomes a routine. This is not a scary process. He's already used to it during his growing years. Third of all, if there is something wrong, early detection, right? We don't have to do aggressive treatment. Something is wrong, they can fix it when it's small. To me, the most important reason to take your child, especially if he's on spectrum, early is, let's say you haven't taken your child to a dentist for 4 or 5 years and now his tooth is hurting. Obviously, there is something wrong. So now you are going to take a child, he's going to need treatment, whether it's first, he has never been. Second, the treatment is more aggressive, a new environment, new people. And now, instead of just getting a cleaning exam, he will get treatment. So it becomes like a scary process. The first experience is not pleasant, put it that way. It will remain in their mind.
Yeah.
Versus if you have routinely taken them, they've had cleaning, they know the dentist, oh, I know this place, they're going to take x-rays. Oh, I know this place, they're going to brush my teeth. Oh, she's going to count my teeth. Versus you're 4 or 5 years old, you're going to the dentist, now they're taking pictures. It's a whole new experience. And then you have cavities and they're going to fix it. So please make it a routine. First birthday, it's simple. They do a visual exam, brush their teeth, done, 5 minutes. And now Medi-Cal, what it's doing is, before it would allow kids to be seen every 6 months, but if they are under 3, every 3 months. So you
Ooh,
can go every 3 months
wow.
until they are.
Okay.
And if they are up to 6 years old and they are getting cavities, then also again they're high risk. They can go every 3 months. But for
Wow.
me, if I have a patient on spectrum, whether Medi-Cal covers it or not, I always tell them, instead of 6 months, bring him every 3 months. I'll just have a look. That way he won't forget me. That way it won't be a new scary experience. So
Love it.
is
Miss
the
Brenda is also saying, forgive me one second. Miss Brenda has written in and said, yes, she definitely agrees with you starting at an early age. And we want to thank Giggle Pickles, who has shared us on their Facebook. Thank you, Giggle Pickles. Sorry for interrupting you, Dr. Shaw.
No, no, not at all. I'm enjoying this actually. And then another important thing is, parents often ask me about the sensory issues. They're having a tough time brushing their teeth. So here's what I want you to do. Start early. We already discussed that. And then start introducing sensory touches. So first start with back of the head, press for 2-3 seconds. Start early, 2-3 seconds, couple of times a day. They will get used to it. Next, move on to the side, move on to the face, cheeks. So they'll get comfortable with you touching them.
Yeah.
Next, get a wet cloth. Introduce the wet cloth on there. You're doing it slowly. You're not just jumping and going in there. You don't want to scare them. Get a wet cloth, introduce it to the cheek, then slowly introduce it to their teeth. They'll get used to the wet cloth. So start early. See, this is why I want you to start early. And then once they are comfortable with the wet cloth, get a soft toothbrush. Introduce it without toothpaste. Okay, just so you're not, take it slow. Take it slow. So now you've introduced a soft toothbrush. Just brush slowly. They're young, they will get used to it. Next, introduce the toothpaste. I always say, first introduce the toothpaste that has no taste, So you're actually increasing their sensory stimulation slowly, and this will help you brush their teeth.
Okay.
Also, don't get discouraged. It's not only the kids in spectrum that fight brushing. Every child fights brushing. You fight back. If it makes you feel any better, I used to sit on my son till he was 2 years old. He didn't like it. And my husband, honestly, so many times he said, are you brushing or what are you doing? I said, I'd rather brush than he get cavities.
Yeah.
But so don't feel bad that it's your child. Most of the children will fight, but you keep doing it until they know that this is a part of a routine life. And then I know After 2.5, I read the book to my son, I showed him videos, and then it was all easy.
Well, and we know that social stories is something that helps ease the anxiety that our kiddos are having, and it helps give a format for parents so that their anxiety and caregivers that their anxiety is eased as well. So you've got these books, and we mentioned before, but where is there a place where they can go right now to look at Sam and the Sugar Bug? And you've got
Yeah,
several books now.
I do. Sam and the Sugar Bug is the one that will help your child understand the need to brushing your teeth and also kind of give them an idea of what happens during treatment. Um, for if your child doesn't like reading physical books, is interested in more, it catches their attention to watch, then I would recommend iBooks, Sam and the Sugar Bug. Because
Okay.
remember, Shannon, you've seen that, the one with the
Oh yeah.
narration, with the music. So that's the one I recommend. But if your kid likes hard copy, then I would get No Rushing When Brushing. It has 2 books in it. It's also in Spanish. I got a lot of requests from teachers to translate it. So it's Cepilate los dientes con calma. I'm going to send you the links, but those are hardcover. So you have to choose. If your child is more into audio, then go to iBooks and download Sam and the Sugar Bug. If you want to read over and over again and show them visually the pictures from the book, then go and, on Amazon, and No Rushing When Brushing has both Sam and the Sugar Bug and Layla's First Visit to the Dentist. I forgot to tell you one thing. You were asking me how to get them. Another way I tell parents is when you go to the dentist, let's say you're going at an age of 3, you haven't been, like you said, take them for a tour first to a dental office. That day, don't do anything. Just show them, have them watch, talk to your dentist, say, I want to bring my child to a dentist, but I don't want to have him or her be scared. So I do that with a lot of my patients. I tell them, come, watch us. That way they become familiar. Also, like I said, read the books, Layla, and the First Visit. I've done it page by page, what happens at the dentist. So, but don't just rely on the book. Have a tour of the office before you do that. So your child is familiar.
Yes. And somebody else is recommending as a fun activity, guardians and parents should brush teeth together at the same time. Our autistic children will watch and mimic what we do. I love that.
Yeah,
Um,
and Sesame Street has a really nice video of such a musical one about brush your teeth. I wish I could let me see if I can pull up before the show ends, and I'll send them the link because it shows families brushing together. Like I said, you can play that song, dance with them, and brush together with them to make
well,
it.
we'll Google that. I want to ask you more questions. I'd rather have your attention because I want to know now that we've talked about brushing, and in the beginning we're not going to do the toothpaste, but eventually we're going to get to the toothpaste. So I think a big question on a lot of parents' mind:
Fluoride.
fluoride, no fluoride. What do
Okay,
you say?
so here's what I say. Up to the time, this is off of my experience, nothing, not written in books, documented, but what I have been doing for 20 years. I always tell my patients use safe to swallow till they are 1 years old. It's called a training toothpaste. Fluoride is good for your children's teeth. It helps prevent cavities, and all the companies put only that amount of fluoride on toothpaste that is safe. So if you're using fluoridated toothpaste, no harm will be done. Remember that. But from 1 to 3, I want you to use just a smear layer, not like a whole squirt. So smear layer of children's fluoridated toothpaste, very little. And after 3, it would be pea size. Now, they may not like the taste of the fluoride toothpaste, so don't stop brushing because of that. For me, brushing is more important. Yes, you need fluoride, that helps, but if that is keeping your child from brushing because of the taste, brush their teeth, even with water,
Okay.
because your kids are in spectrum. But preferably, fluoride will prevent cavities, but use it in limit, only smear layer till they are 3 and pea size after 3.
Yeah, I
But
think a lot of people are using way too much toothpaste.
yes, so
The
that's what that was
is not
important.
much.
Yeah, so that was important. Safe to swallow. This is my personal, you know, experience, and what I've learned is it's better to use safe to swallow because they're going to eat it. After one, if you use smear layer of fluoridated toothpaste till they are 3 years old, you're fine. At 3, use pea size. But if for some reason, because the kid is on spectrum, doesn't like toothpaste, don't stop
Better
your
to better
making.
to brush with water than to not
Anything
brush
is
at all.
better than no brushing. Remember that.
Okay, good.
So
Now
that
let's talk a little bit about what sedation, because we bring the kiddo to the dentist, and there are lots of discussion about this among parents about,
yes.
especially when kiddos are on the spectrum, it may be easier to do the gas, but sometimes they don't react well to it. What is your thought on what's
Okay.
safe and what we should
So
use for
I'm going to
sedation?
explain to you the way I explain to my patients in a very
Okay.
simple manner. When they're doing exams, cleaning, nothing is needed. They're already used to it. But when they need treatment, there are 3 kinds generally all offices follow. One is nitrous oxide. It's the gas we were talking about. Think of gas, nitrous oxide, as a simple relaxant. You breathe it in, it relaxes you a little, but you're aware of everything that's going around you. So some kids do well with that. Okay. Some kids, it works well, as in they breathe it, but if the child is crying and, really anxious, they may not breathe it. So then it's not going to work. So that's how you decide, is nitrous enough for the child? Usually the dentist will know. When I do my exam, I kind of know, okay, um, the nitrous will work on this child. And sometimes older kids, they breathe it in, they're calm, you talk to them. So those are the kids that are good candidates for just nitrous, and then they'll numb them and do the process. Now, not all kids are like that, right? Then there are kids that are more anxious and need a lot of work. For them, there's something called oral sedation. This is the next step. I'm kind of giving you step by step.
Yeah.
Oral sedation is a drink we give them. That doesn't put them to sleep, kind of makes them a little woozy. Think of it as getting drunk. I'm sorry. I just want to make it easy for you guys to understand.
Yeah.
So when you're
Yeah.
drunk, you're doing things, and when you wake up the next morning, you're not clearly remembering what happened. That's exactly kind of what oral sedation does. What it does is you're kind of woozy, some kids go crazy, they're crying. I can tell you from my experience, my niece went ballistic with oral sedation to the point my cousin called me and said, "What is going on with her?" Because she was crying, she was, through the treatment. But once the medicine wore off, she didn't remember anything. So I told her, be calm. It is okay. Different people react differently. Some are calm, some start kicking, some start crying. But the point of sedation is not to not make them cry. It's because they're still awake. They're still, knowing things are happening. There's not much of the recollection of that. Kind of
Okay.
think of it that way. But some kids might fight it. It's like, one person needs one shot to get numb, some need two. But oral sedation is a drug we can only give so much according
Right.
to the weight. So if you fight it, you have fought it, then, you will remember it.
Okay.
So that, unfortunately, we only know once the treatment is rendered, how much effective sedation was. Then there are those parents that really want another to go one step forward, or the child is older, he's on spectrum, sedation is not going to do much because of that dose. We put them out. Okay. That means general anesthesia if they need, especially if they need a lot of treatment. And also, I always tell the parents with spectrum, if he is going to have a traumatic experience, he or she will not want to come back. So that has to be taken, that decision has to be taken wisely. If you think your child is going to fight it and make it's going to make it difficult for him to or her to go to dentist next time, then I want you to choose general anesthesia, because they'll be out and they won't know all of that. This is all for treatment, when they need a lot of treatment. Here's
And
another.
I'm so happy to hear you say that, because we've been dealing the last couple of weeks. We have one parent who's been writing in who's going through a terrible time because her child did go to the dentist, was traumatized, and he is having a really hard time. And it's been weeks. He's still having a hard time and is terrified. And they didn't put him all the way out. I don't know which of the first two they used, but at one point they restrained him, and he
Yes, they
remembers it
will
and he's
always. Yeah,
terrified.
the thing is that if you're using oral sedation or nitrous or any, they will restrain because the instruments are sharp. If you move your arm and leg, you can potentially hurt yourself. So they most of the dental offices do restrain them just for that. If the child is
Yes.
moving too much, for example, my niece, she was going ballistic. So we cannot take that chance. We can cut their lip. So we do have to put them in the blanket. But again, we have to choose the right mode of sedation for them. So talk to your dentist and see which is now there are three types of things that can be used. So she or he can choose the right one for you. That's what
Okay.
another Shannon
And
I
they're
want.
all safe. They're
They're
all
all
safe.
safe as long as they are measured by body weight. So it has to be a dentist with a license who is doing it. It has to be the right amount of drug. Another important thing here is medical history. Does a child have any medical problem that will compromise him taking oral sedation? Does he need to be hospitalized because if he's getting general anesthesia? So these are the questions I want you to ask. So
Yes.
it is safe, yes, because we are measuring the right amount of drug. We're checking the medical history. Is it safe to be administered in a dental office? But again, if I see a patient has uh, medical conditions and it can make it dangerous for a dent, then we send him to the hospital because they have all the better things to control the. But another thing, Shannon, I want to tell you is that the only problem that comes with general anesthesia is I think Medi-Cal doesn't cover it. So we are trying hard to push that. I've been fighting it. So if you can join the fight, that would be awesome.
Sure.
It will make it easy for kids to go and get it
Absolutely.
because the parents, they have to go from play hospital to hospital. The wait is long for general anesthesia. I need an advocate for that. I've been
All right.
advocating.
Sign me up. Sign me up for that. I'm willing to help with that. But I also want to say, though, that it sounds like from all accounts here that the earlier we start going to the dentist before there's a problem, because it isn't just
I,
about the child understanding how the office works. I think that if a parent or a caregiver is there and gets to meet the dentist when it isn't urgent, then you guys together can have the conversation about what you
yes.
think for the sedation. And it's
It's
not
it's
this,
all about starting early. It's
yeah,
all about starting early. And hopefully when you're going to dentist from 1 year, they won't get to the situation where it gets so
yeah,
bad. You
yes,
that,
yeah. So it's one of those things to do early.
there is something very important I want to tell your audience about.
Yes,
I always advocate for that. Nursing bottle syndrome. Did you see the
yes.
pictures? Do you think you can
Yeah,
see those
I
pictures?
can't bear to look. But talk to us a little bit about what nursing bottle syndrome is.
Yes, this is a very important information that I want all you parents to know. And if you hear it, I want you to share it because these are cavities that affect kids as young as 2. And the cavities are not what you see normally, like one here, one here. It's heartbreaking. It eats away all their teeth. So I have seen kids that have got those cavities that are 2 years where I had to remove the teeth or I had to. Have you seen kids with silver teeth? So those are the teeth we have to clean, put medicine, put crowns on them. So this is what I want you to avoid. So what causes nursing bottle syndrome? One, after first birthday. So feeding at night. Let's start with feeding at night. You're feeding your child multiple times at night. They fall asleep while you're feeding. They do not swallow the last part of the milk. Remember that. Most of the kids. So that milk soaks their teeth for hours and it rots their teeth. Okay, so by the time they're 2, it's really bad. It breaks my heart. So here's what I want you to do. Whether you're breastfeeding or giving the child the bottle after first birthday when the teeth have come in, I'm not against breastfeeding. Please don't get me on that. Breastfeeding is great. We're just talking about at night feeding or nap when they nap. So what happens, like I said, they don't swallow the last part. So after first birthday, I want you to get into habit of reducing the feeding at night. Give them a good dinner, brush their teeth, go to bed. I'm a mother too, doesn't happen overnight. So, these are things we all talk about, but are not that easy. So try your best, slowly reduce the number. But until you achieve that, what I would recommend is when you go to bed, take a bottle filled with water, whether you're breastfeeding or you're giving the child bottle at night. Once you're done feeding, I can't ask you to brush their teeth every time, right? That's too much. I'm a mother too. You're already exhausted. Stick that water bottle in their mouth. They'll suck on it and it'll wash the leftover milk away. Whether they are napping or you're feeding them multiple times at night. And I'm pretty sure you do that, it will greatly reduce the incidence of those cavities. And eventually, you will also wean them off at the right age from night feeding. So after first birthday, try to reduce feeding at night. And until you achieve that, keep a bottle by your side filled with water. Stick the water bottle in their mouth in the end to wash that leftover milk away.
That's
Second,
brilliant. Yeah, go ahead.
second reason for getting nursing bottle syndrome that has become very popular right now is juice. Because they commercialize it so much that parents feel like, oh my God, this must be the best thing for my child. Keep in mind, juice is just sugar, water, and acid. Do not replace it with water. Many countries do not give juice to kids till they are 2 or 3 because of the same reason. Do not give more than 4 ounces a day juice to a child. And that to only one meal if you really want to do it. I would say avoid it altogether. Water, juice is no alternative to water. Now I see patients coming to me with bottle filled of juice. I go to park, sippy cups are filled with juice. Whether it is diluted or regular juice, it's enough for your kids to get those ugly silver teeth, which we don't want them to get. And if we can avoid them, why not? So give them water. And like I said, if you really want to give them juice, 1 time a day, 4 ounces. Feed them every 2 hours. And also another thing is snacking. Don't keep the snacks out where a child would go eat, because there'll be a constant supply of sugar. I always tell my parents, breakfast, let's say at 8, snack at 10, lunch at 12, another snack, dinner. That way you have some period, where there's not a constant supply of sugar to your teeth. So make a routine. Everything should be a routine versus there are crackers outside, he's coming, chewing on one, then because they stick to the teeth. And that's another reason.
Okay, that is great advice.
That's very close to my heart, Shannon. I'm so sorry. I had to say this.
No. I'm glad because, sometimes we are so busy up our own autism tree that this is an area where we don't get things taken care of, and it can end up being a really bad situation for our kiddos. So I think it's really important that we get this information and get it out to the autism community. I also want to say, there are other ramifications for the juice as well. We know that we have seen our kids when they have a certain level of sugar intake, that we get more behaviors, and that some of the juices have artificial colors and we get more behaviors. And unless you're doing 100% pure organic, you're also getting a pesticide, which also increases behavior. And we're not even talking about how the prevalence of diabetes in kids these days. In the United States, it's off the charts. It isn't that way in other countries because we are giving so much juice. So for all of those reasons, juice is not a good idea. So I appreciate you talking about that. So, and Traven, she just put the link in our private comments for the book.
I put the link.
But I want you to hold the book up again. I'm sorry.
Yes, I want to send you these links. The link I sent you, Shannon, is the one for the kids with special needs.
Okay, but I want you to hold the book up again because I think the easiest thing is that people are going to go to Amazon or go to iBooks. But I want you to hold the book up for us again because it's beautiful. I want people to see what a beautiful book it is. And you can be reading this with your small children or have them read it and you sit with them and talk about it. But we know that that kind of learning is move it just a little bit over that way, the other way. Yeah, it's weird. So no rushing when brushing. Go to Amazon. You can get that today.
Yeah,
or if you want, Go ahead and show,
One
because
is
they're
the
beautiful
salmon.
illustrations.
Look at that.
The
Salmon,
other
the
way.
sugar,
Yeah, there we go.
to encourage them
Love
to
it.
brush their teeth. And the second one in that, so it's a pack of 2 books that I wanted parents to have, so they have everything they need. It has the second book in it is Layla Visits the Dentist. So that way you can read, but remember also reading, I would recommend after you read the book, you take them for a tour to dental office to make it easy for you.
Absolutely. And not only will it make it easier for them, it also helps the caregiver. Now you have a working relationship with the people in the dentist's office, which is the thing you need. Please don't wait until there's an emergency, because then everything's rushed and you will feel like, Dr. Shah, for people who are in what area would people have to be in to have you as their dentist?
I really go to different dentists, I mean offices. So it's not just me. You can go to any dentist, but as long as it's a children's dentist, that's my point.
Okay.
I mean, children's
All right.
dentist. So
Yes, but we all want to go to you now. But
the basic thing is that I only do the exams. I don't do the treatment. So I don't want them to be disappointed that when they come, I just do exam, education for the patients. So I don't want
well, and
them.
that's a lovely thing. That is a lovely thing. But
So I
Dr.
don't.
Shah, we're out of time, unfortunately.
I
But
know,
I
but
appreciate
remember,
you.
Shannon, I
Yeah.
want you to encourage them to go to a children's dentist, not a general dentist. They would not know what to do.
Yeah, you guys, you got to go to a pediatric dentist and visit first. Not only will it, and maybe you need to visit more than one. You walk into an office and you feel if the dentist is going to be good with your kiddo on the spectrum, and the people in the office are going to be good, and if they're going to let you do the tour. If they're not letting you do that, that's not the dentist for you right now. So, but we need to be listening to the good doctor, and please get her book and read the book with your child. We need to normalize as much as possible good dental habits with our kiddos. Otherwise, it comes back to haunt us later on. Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. To subscribe, click here. And if you'd like to check out some more of our videos, click here.